Good morning, I'm Julia and this is Larissa from Rising Spiral Massage. Today we're going to do a technique of the week that targets rotator cuff tendon pain. So this technique I like to call the eagle arms technique because it requires the same sort of hand and arm motion that we use in an eagle arm pose in yoga. If you guys are familiar with eagle pose, this is eagle arms, right? So we're going to do this same sort of arm with our client. It's a great way to manipulate the shoulder and to have full range of motion in the shoulder while you are doing manual therapy. So if we're working with your client's right side up, we're going to take our right arm. So her right arm, our right arm. Right arm goes underneath and then connects right here, just like this, just like a two-person eagle arm would look. Now I've got full range of motion of her entire shoulder and my other arm free. So I'm going to create a horseshoe hook with my other arm now, with my other hand, and I'm going to put it right over the top of her humerus. So it's not on the acromion, it's not on the upper shoulder, it's actually below the shoulder at the very top of the humerus. So now I'm going to put this horseshoe hook right here and I'm going to start mobilizing the shoulder in circles, and I'm going to feel for points where it likes to catch. If you look at your shoulder anatomy, you'll see that the humerus, where it inserts into the glenoid fossa, the glenoid fossa itself is kind of shaped like a pear. It's got a big wide belly at the bottom, and it's got a smaller piece to the top of the ellipsis. So we want the shoulder to be able to move in the entire pear shape. What tends to happen with people, they tend to have shoulders that are elevated and forwardly rotated, and they get stuck up at the top of the humerus. The head of the humerus gets stuck up at the top of the pear. We want it to be able to move down in the big belly. So this technique gives us that range of motion. We're actually actively pushing the humerus down into the belly of the pear. So that's what I imagine I'm doing. I'm going to create my hook again, and I'm going to ask Larissa to try to drag her elbow down toward her hip. So she's going to activate now, and I'm going to hold that there for 3, 2, 1, and when she relaxes, go ahead and relax. I'm going to mobilize the shoulder, and I'm going to push that humerus down to the belly of the pear. Let's try that again. Elbow toward your hip for 3, 2, 1, and relax. If I feel like I'm hitting a point that feels just a little sticky, especially as I'm palpating along the attachment points of the rotator cuff, right here in the bicipital groove and in the intertubercular groove, I can hold that place and create more movement with the shoulder. So it's like Ida Rolf used to say, put it where it put it where it's supposed to be, and then ask it to move. So I'm pinning that tendon where it's supposed to be, and then I'm asking it to move. Do you feel that, Larissa? Do you feel that little spot right there?
Yeah, for sure.
Yeah, nice. All right, thank you guys so much. This has been our technique of the week. We'll see you next week. Come and see us at Rising Spiral at 1707 West Koenig Lane. See you soon.